the honest answer is that we probably don't know specifically about sarcoma, because the NHS healthcare data systems are not set up to collect that level of data in terms of what we call protected characteristics. So not just sexual orientation and gender identity, but even quite fundamental things like which language people speak or whether they need assistance coming into the hospital. That information is not necessarily collected or recorded well, and even worse, if it is collected, it's not acted upon. What we do know from the UK's National Cancer Patient Experience Survey, which goes out to many thousands of patients every year and does ask proper questions about background and protected characteristics, are that there are discrepancies between the experience of care by LGBTQ plus people, which is lesbian, gay, bisexual, transgender, queer and questioning, and the rest of the population. And they can relate to knowledge about cancer and tumour risk factors, healthcare seeking advice in terms of relationships with their general practitioner, so later presentation, probably less relevant for sarcoma, but relevant for other tumours, is health, lifestyle risk factors. So tobacco, alcohol and drug consumption are higher in the LGBTQ plus population. And then when they get to the hospital, the clinical and working relationship with the clinical staff is perhaps not so good. So you see that in terms of feedback about trusting the healthcare professionals' communication skills, how they work with teams and feeling that the team is looking after them as an individual rather than just the tumour entity. And then psychological distress and pain scores are all higher and worse for LGBT plus people. Where that's perhaps particularly relevant for sarcoma patients, it can be relevant in all situations, but it's particularly perhaps relevant for people with pelvic sarcomas, where there need to be careful conversations about the impact of treatment on pelvic organs that are relevant for reproduction and sex life and sexual activity, because a lot of our treatments can have an impact either on ovarian function or the uterus or the anal canal and rectum, and they can be really important. And if those questions are not addressed, you're not necessarily giving the best advice that you could do for the patient. And so helping healthcare professionals to understand those important challenges and how you best address those with patients is something that I think is really important to consider.